Today we honor someone who never took a course in medical school and still became one of our greatest teachers of medicine. This individual helped change the way we understand how the human heart works forever. And now I'm honored to read. The Board of Regents of the Johns Hopkins University, in consideration of an innovative scientist, an outstanding teacher, and a skilled clinical technician, has this day awarded this honorary doctorate to Mr. Vivian Thomas. Congratulations, Dr. Thomas.
Thank you, Dr. Towser.
There's no cut down in cannula in the femoral vein. I showed you how to do it.
I figured out a way to give it barbital intravenously.
Where you putting it?
In the forepaw.
The manometer?
It's all set up, Doctor.
Good. You can begin the incision.
I'm not ready for that.
If I say you're ready, you're ready. I'll mark out the line, and you cut along it. Just like you did for your old daddy.
Like this?
Just like that. Keep your hand taut. Why are we making the incision here?
To gain access to the pulmonary artery.
And how will we find it, Vivian?
It's the artery leading to the lungs from the right side of the heart.
Not bad. Now the rib spreader. And why are we gonna damage poor Brutus's greater vessels?
To induce traumatic shock to study it.
Watch this manometer. And imagine a Brutus is a 16-year-old boy who just fell out of a tree saving his mom's cat. He's broken 4 ribs, he's concussed. Dad's rushed him to ER, but he's gone into shock. His blood pressure's way down, his vital signs almost non-existent. Can we save him? Not if I use present methods of treatment. See, conventional wisdom says I should constrict the vessels. I beg to differ. Let's break their rules. Use my rules. Body needs blood. Let's give it some. How's that gauge?
Still falling.
Maybe the experts are right, maybe I'm wrong. Maybe I'll kill this boy and break his mother's heart.
It's rising. That's life coming back.
How does that make you feel?
Good. Very good, Doctor.
Let's look at the record of our work. Put away the books, Vivian. Let's not waste any more time on theoretical crap. Let's start with experiments. 4 separate defects of the heart working in combination. The pulmonary artery is constricted in the main artery before the divide, diminishing blood supply to both lungs. And the hole in the septum causes the used blood to flow back into the arterial system instead of flowing through the lungs, turning the babies blue. The baby's heart's delicate. It's a goddamn minefield. The first step is to see if we can create the blue baby condition in a dog and then come up with a plan to solve it.
You're drinking too much coffee.
Balzac drank 300 cups of coffee in one day. Of course, he died of a perforated ulcer.
The odds are against us reproducing this in the laboratory. Are you sure this is a limb you want to climb out on?
Back in '29, when I had TB, the x-rays showed a big gaping hole in my left lung. I lay there on a freezing porch in a sanatorium in upstate New York with 18 blankets on me, nothing but my nose exposed to the elements. Death's a very humbling thing to live with day in and day out. I swore then, if I got my life back, I would do something important with it. I know in every fiber of my being that this is a limb I want to climb out on. It's gonna be hell trying to work with a child's vessels 3 or 4 millimeters thick.
Like sewing overcooked spaghetti noodles?
We'll need the smallest sutures. You're gonna have to do most of this research. What'll you need?
I need a bulldog clamp. Small enough for the baby, but strong enough to stop the flow of blood.
What about a breathing device?
I'd love a positive pressure respirator, but with this war going on?
Yeah, how in hell can I do the experiments if I can't even get the equipment? Oh, shut up. A shunt.
I'm sorry, Doctor, what'd you say?
We need to create a shunt to get more oxygenated blood to the lungs. Can't see how to do it.
Remember back in Vanderbilt when we were doing the research on how to create high blood pressure in the lungs?
Yes, I connected the subclavian to the pulmonary artery.
We failed to get the high blood pressure, but we did get higher blood flow.
Which is exactly what Dr. Towsig said these babies need. That's it. We build a bypass. Take an artery and redirect it.
Systemic artery to the pulmonary artery, then
Through the lungs.
it's a long way around, but it gets you there.
If we work from the right side, we have an advantage there,
But the recurrent nerve is in the way, and if we kink that,
vocal cords paralyzed.
and the carotid's here.
We may kill the brain if we damage that. Comforting thought.
The subclavian. Tied off here. After the divide, cut it right under the clavicle, swing it down, long, slow, gentle
Will it
arc.
hold if we pull it down 4 inches?
If your hands don't get too excited.
Thank you for the vote of confidence.
No one's ever done anything as hard as this. Changing the course of blood.
It turned blue into pink. Death into life. Dr. Longmire.
What is going on?
They won't page him.
Why not?
Something about hospital policy?
Page Vivian Thomas immediately.
Dr. Blalock, what's wrong? What's happened?
It's all right. I won't tell you again. Page it.
We're only allowed to page doctors.
Give me that goddamn phone. Vivian Thomas. Paging Vivian Thomas. She wanted it in OR right now. Come on the run. You hear? This is Blalock.
Thank you, babe. Good luck.
Jesus.
About time. Scrub up.
Scrub up.
You're coming in with me. Would you find Mr. Thomas something to stand on?
What for, Doctor?
You're talking me through this. Now, scrub up.
What's he doing here?
I'll see about this.
Should we say a prayer?
Forget it. He won't listen to me.
Dr. Blalock, a word. You can resume your duties.
These are his duties. Can you see now?
Yes, doctor.
Okay, I think we're ready to start.
Okay. We're going in.
It's gonna be all right. We'll be just fine. It'll be all right.
Incising the mediastinal pleura from the main left pulmonary artery.
To the apex of the pleural space.
I'm dissecting the pulmonary artery.
Well back into the mediastinum.
Is this all right, Vivian?
That looks fine.
The right angle clamp. Okay, I think it's holding.
Are you able to deliver the left subclavian artery?
I believe so. Blood pressure?
70, falling.
I do not move that light. And now I'm dividing beyond. Clamp it, clamp it.
I can't reach it, Doctor.
I got it. Hemorrhage controlled.
Can you see, Doctor?
Not really. Nurse? For goodness sake, can't you even see my ears? Suture.
Blood pressure 68.
Yes, go on.
Watch the carotid. Yes, traction on the suture.
Okay, now the clamp Vivian made.
What clamp?
The one just there. Right here. Yes.
We're about to connect the shunt.
Blood pressure 60. No, 59.
I know, I'm almost there. Now, front interrupted.
Good. That's good, Doctor. That's good. Just a little more now.
Removing the bulldog clamp.
I see some bleeding there.
I know, I see it too. Suture. Suture.
No, Doctor. The other way.
Yes, yes.
Good. You got it now.
Bleeding controlled. I'm palpating the connection.
What do you feel?
I can't tell if blood is flowing through the shunt. It's just too small to feel anything.
Dr. Blalock, you have to see this.
Oh my God.